Flatheads are a real concern nowadays. We have a mom here today with questions about this issue. Jennifer is here with her adorable 8-month-old Carson. Welcome to both of you. So it is the Flat Show.
Yeah, we're talking about flat things.
And what's your question about flatheads?
Well, based on those guidelines to prevent SIDS, I want to make sure that I'm doing everything I can do to prevent him from having a flathead.
Jennifer, you want to bring Carson up and I can kind of show you what we're talking about?
What do you think of this, Carson, huh? Is that a pretty good
Mr.
tasty
Carson.
blanket?
Yes.
So we're talking about crib safety, and it is important to still, yes, have babies sleep on their backs. That's the first thing we're going to do. So let's have Carson get into the crib here. But we want to try to mix it up a little bit. Are we going to lay down? Are we going to lay down and go for a little nappy?
Oh.
Now, we want to have babies sleep on their backs, but you want to mix it up a little bit. Try to alternate and mix up the position of their head. We don't want them always sleeping on the same side or on the back of the head. So maybe one night, have them, hey, buddy, try to have stuff, a toy or something that they can get their attention, or maybe facing the door one way or the other, so that the head is maybe turned one way one night and the other way the other night. And just kind of go back and forth, all right?
Okay.
Also, we want to do lots of tummy time. So we're going to do some tummy time, buddy? We're going to do tummy time. That way the head isn't resting on the back of the crib all the time. Also, you want to limit
So tummy time when they're not sleeping.
Well, when they're awake. That's
Right.
a really good point, Travis. Also, try to limit the amount of time that they're in a car seat or in a swing where their head is just leaning back.
So those are obviously things you can do to help prevent a flathead. But
Right.
let's just say no matter everything you've tried, there's a 9-fold increase in flatheads, and you develop a flathead.
Yeah, I'm seeing a lot of it. Now, there's two things parents can do. First off, you want to have the baby checked by the doctor, make sure there isn't anything else going on. But you can do nothing if it's not that noticeable, and the heads will usually self-correct within 3 to 5 years. Now, that's a long time. Parents don't want to wait that long sometimes, and you want to be a little more proactive, and then you can use what's called a baby head-shaping helmet, something like this here. And I'll let you hold that. You see, it's very lightweight. It's very soft on the inside. I'm going to show you, you're going to see some B-roll of a baby being measured. It's basically, we get a little 3-dimensional image of their skull. And this helmet is made especially for the baby's head. And how it works, it puts a little pressure on the front and the sides of the skull. And then it leaves it kind of open in the back. Basically gives the skull a little room to grow into there. And they're designed to be worn 24/7, except for when they're taking a bath. So, but it works pretty quickly. It'll fix a flathead in about 12 months.
Oh, wow.
And so, pretty quick.
Yeah.
And a lot of parents like to decorate them.
Kind of like braces.
It's kind of like braces for the head.
And maybe the most important thing, because people are sitting out there at home thinking, well, I have a baby, and SIDS versus flathead. SIDS kills.
Right.
The end result is death.
Yep.
Flatheads, we're dealing with a cosmetic issue here primarily,
Exactly.
right,
Yeah.
Dr. Shears?
This particular type of flathead. We're talking positional plagiocephaly. The only reason for the flathead is the position of their head in the crib. That is purely cosmetic. It's not a medical issue, but it is important to have the doctor check, make sure the rest of the bones are growing normally, because there are other reasons for flat parts of the head, something called craniosynostosis, which is a much more serious problem, needs to be corrected early surgically. He does not have that. His head is really good. As a matter of fact, his head really isn't that flat at all. So
well,
I think
I've been trying those things. I get
Yeah.
worried. I position him.
I do not see a helmet in this guy's future at all.
I can tell right now, no one keeps Carson down. He's an explorer. Well, best of luck to both of you. Thanks for coming on the show today.